welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the NARM Training Institute. I'm your host, Sarah Bueno, and I'm delighted to have you join us today. The NARM Training Institute is offering a Level 2 NARM therapist training online so that you can attend from anywhere. The trauma field is evolving so quickly. Trauma-informed therapists who want to learn how to address the long-term impacts of adverse childhood experiences and complex post-traumatic stress disorder want to be trained in NARM. This online NARM therapist training is starting in July 2021. So if you're interested, we'd encourage you to register now to reserve your spot. For more information and to register, please visit www.narmtraining.com/level2online. We look forward to you joining our growing international NARM community and are inspired to work with you to bring NARM to your clients and communities in order to transform trauma. Hi, Transforming Trauma listeners. In today's episode, we're excited to share a sneak peek into the NARM Inner Circle. The NARM Inner Circle is an online learning program for those interested in joining an international community of helping professionals passionate about healing complex trauma. The Inner Circle provides ongoing, in-depth learning from the NARM creator, Dr. Laurence Heller, and senior trainer, Brad Kammer, as well as other NARM faculty. In this Inner Circle webinar, NARM and Working with Anxiety, Anger, and Rage, the focus will be on how unresolved anger can lead to anxiety, a common symptom so many clients deal with, and how the NARM approach works with protest and anger to support a client's reconnection with their authentic self. Larry and Brad will touch on such areas as how childhood protest turns into anger and rage, the difference between healthy rage and unresolved anger, how NARM holds anxiety not as an emotion, but as a process related to our emotions, how does unresolved anger relate to anxiety and panic, how NARM works with the impulses towards vengeance and violence, how NARM supports containment and not catharsis, and how feeling into primary emotions of anger and rage without acting them out can lead to expansiveness and a sense of freedom. They will also be introducing several self-reflective exercises to support your own learning process. We invite you to pause the episode and take time to reflect during the exercises if you wish. We hope you enjoy this special episode of Transforming Trauma.
Welcome everyone to our Inner Circle webinar. I know for a lot of us, this is a resource to come together in our NARM community, our international NARM community from folks all around the world, and just dealing with all the difficulties in the world. It's nice to come back and to be together and to talk about work that is impacting us and impacting our clients in so many profound ways. And so today we're going to look at anger, one of the emotional responses that we focus on in NARM. And we also have anxiety in there too, as you'll see. Larry, anything you wanted to say as we get started here?
Well, just that this is such an important element of the work about integrating anger and how when anger and rage get integrated, how anxiety and depression and self-hatred diminish. So this is really a core piece that we're going to be talking about today here.
So as most of you know, if you've been here before, we like to start off with a reflective exercise. And so these are invitational, and we're going to invite you to just take a few moments to reflect on a time when you had unresolved reactions to an experience that you might have protested but didn't. So an experience that you had where there was unresolved reactions to an experience that you might have protested but didn't in that experience. And just to take some time to notice as you think about that experience and the aftermath of that experience, how that is right now for you internally. Larry, I don't know if there's anything you wanted to say about the exercise before we move on.
Well, we started with this exercise because as people respond and adapt to various kinds of misattunement and abuse and neglect, one of the things that they tend to disconnect from is anger, and within the anger is always protest. And part of what we'll be talking about today is how as anger and rage get integrated, then the capacity for protest gets reestablished. Protest in a healthy way, just to be able to speak up for yourself and to communicate needs and set boundaries and all of those kinds of elements that are so important for us as human beings.
We're going to start with anxiety. So in NARM, we don't consider anxiety an emotion, but how does anxiety relate to this emotional process that we're going to be talking about today?
Mm-hmm. Yeah, and I know that, for some people, depending on their experience with NARM, that's a new thought, that we make a distinction between anxiety, which we consider a signal, something communicating a message to us about usually some other emotion that's coming up. And we contrast that with fear, which is an actual emotion, which, when there's a real threat that is present. Whereas anxiety is usually about some kind of internal threat. Whether or not a person realizes that it's actually internal is another question. But it's an important distinction to make that fear is an emotion. Anxiety for us in NARM is really a signal that there's something that we're not listening to in ourselves.
And is the something that we're not listening to, what is that something?
Well, often, as we're going to be talking about today, often it is anger. And when a child has learned to foreclose anger and protest very early, then when they start to naturally feel it, because this is an inbuilt, hardwired human response to protest when things are difficult, when needs are not being met, and then particularly for children, this is important. So that it's often anger, but it could be other emotions. It could be, for example, that there's unresolved grief as well. And instead of allowing them, the grieving feels too frightening to an individual. Many people express the fear that we talked about, that you talked about actually last time, is that if they feel their grief, that it'll never end. And so instead of feeling it, they disconnect from it. And then it actually doesn't ever end, as the point that you made. And when we start to feel it, we get anxiety signals. So it's really an indication to us to listen more deeply to what our inner process is. And it's usually either grief or anger that is coming up that is frightening. And that's what the anxiety is signaling to us.
Okay, maybe I'm going to get too conceptual here, so you can let me know. But
Okay.
Is there something important about the language that we're using, that anxiety is not an emotion, that connects to how oriented we are in NARM to agency?
Well, yeah, I think it is a little bit theoretical, but it's fine to go there, that it's important to make a distinction between what's a real emotion and what's, as we're talking about here, what is an indication of an emotion, but not an emotion in itself. Mm-hmm. Because we talk a lot about, as many of the viewers know, we talk about emotional completion. And just staying with anxiety, as some models do, they'll take people deeper into their anxiety, generally does not lead to emotional completion. So it's important in the emotional completion model that we be clear what are really emotions that can be completed and what are other strategies or default reactions that really don't take us to completion. And obviously what we're here to do is to teach and to help therapists and other people come to completion and resolve deep internal conflicts that, we all as human beings carry to one degree or another.
Okay, so most of the people in the inner circle have been introduced to the distortions of the life force, but maybe you can talk a little bit more about the distortions of the life force process in relation to the way that anger leads us to running away and shutting down.
Yeah. So in the developmental years, the child's development, even before words, one of the ways that children communicate to their caregivers is through protest. If they're ill, if they're cold, if they're hungry, if they're wet, they start to fuss, they start to cry, and in a way they'll actually start to get angry too. But the protest, you see, even if there aren't words to it, is a communication to the environment. And then when protest is not responded to, as in cases of misattunement or neglect, for example, when protest is not responded to, then it amps up for the child into anger. And this then creates an incredible dilemma for the child, because a child's mind can't hold both love and intense anger towards the caregiver. That capacity comes later, that we can be very angry with our partners, for example, or our spouses or whatever, and still love them. There isn't, in an adult human being, at least the capacity is there, is to hold these seemingly conflicting emotions, but a child can't do that. And so anger at the caregiver represents a profound threat to children. And then one of the ways that they manage that is through splitting. And what that means then is that they split the image of the caregiver into the good mother and the bad mother, the good father and the bad father, and the image of the self into the good self and the bad self. And a question that, we've posed before here, but one more time to reflect on this is ask yourselves, is it better if you're a child to be an unlovable child with loving parents or a lovable child with parents who don't have the capacity to love? And
Larry, can you say that again? Slow that down. That's important.
Sure.
Yeah.
Okay. Here's the question. Is it better, from a child's perspective now, is it better to be the lovable child of unloving parents or the unlovable child of parents who don't have the capacity to love them in the way they need? And I think if you look at it from a child's perspective, the answer is fairly obvious in the sense that if the child experiences the parents as not having the capacity to love them, there is really no hope left. And remember, the parents in the beginning of life are the child's entire universe. If the parents can't love them, it means there's no love in the universe. And so if they split the image into the good and the bad self and the good and the bad parent, and they identify with the bad self, it provides hope that if they just get rid of the parts that are seemingly not liked by the parents, then maybe they'll be loved. Or if they work very, very hard to be what it is that they think the parents expect of them, then they'll be loved. So you see, and this is so essential in taking the negative, becoming the negative object, as it's called in object relations, becoming the bad child in regular language, is actually protective. And it protects the attachment relationship. This whole splitting process protects the attachment relationship. It preserves the possibility that there is still love in the universe. And it's just that they're doing something wrong. There's something defective with them. And yet, as painful as that is, that gives them hope that maybe they can fix that. Maybe they can be loved. And so when there's splitting, one of the most common strategies then is to shut down. And because one of the things that's important to remember is that splitting, for those of you who are psychodynamically trained, is usually just seen as a mental process. But in NARM, we see splitting as a psychobiological dynamic. And to split your image and the self-image and the object image takes a tremendous amount of energy. And of course, you see, when you've got all of this energy holding off this, pushing these split off elements of experience out of consciousness, it takes a tremendous amount of energy. And part of that whole process then is a shutting down dynamic. Okay.
So there's a question that comes up a lot for therapists in terms of like a client that's angry all the time, which generally we refer to as might fit into the category of default emotion, versus the felt sense of anger that comes up when you felt wronged by someone, which is what we've been talking about in terms of protest and primary emotion. Mm-hmm. And again, I think this is important to unpack because a lot of us are working with clients with a lot of anger, and it's challenging to know what might be more primary for them versus default.
Well, a good question for any therapist or any individual to ask themselves, is this whatever the emotion that they're feeling, is this an emotion that they have easy access to? Is it an emotion that they feel a lot? Almost by definition, if it's something that they experience a lot and if they have easy access to it, it's most likely a default emotion, which means it's another strategy of disconnection. It's a way of disconnecting from an emotion that is more frightening to them, but also has more possibility for resolution. And that's the problem with default emotions, is they keep people stuck in this perpetual loop of experience and nothing changes. So no matter how many times they get angry, it doesn't lead to emotional completion or trauma resolution because it's just going through the same groove again and again. Whereas when they start to move into whatever the emotion that is not so easy for them to access, that tends to be a primary emotion. And as people connect with their primary emotions, then there's the possibility of working through an integration and moving beyond the adaptive survival style mechanisms that we all have developed in different degrees in different ways.
Can something like anger be at the same time a default and a primary emotion?
Well, I don't know if this is exactly an answer to your question, Brad, but what we'll see is that, for example, people who are angry all the time, each individual is different, but generally what we would say is that the more vulnerable emotions like loss and grief and vulnerability itself are covered over by the anger. And so again, the point is that it doesn't lead to resolution. But there was another part of your question that I may have missed.
Well, I just think a lot of people are trying to differentiate between when is their anger in response to something that's really that they feel wronged about, that's a protest, versus that they're just acting out anger in all these different situations. And can anger be both?
Well, yeah, and often you see that once they have integrated like people who tend to use anger as a default emotion, once they have felt more vulnerability and more grieving and more sadness, then there is often another layer of anger, if that's what, that may or may not be what you were driving at, but so that it doesn't mean that we never come back to anger with them. But when it's too easy, when it's too automatic, it's not generally productive for us as clinicians. Now, the other question that you mentioned was, can there sometimes be elements of both? And of course, there's complexity in all of our interactions. So a word that I used in some, either in the podcast or in one of the webinars that we did, is about things being overdetermined, meaning that there could be real anger there, but then the extent of the anger is being actually determined by some other dynamics that are going on. So in that case, then there can be a mixture so that it's some real here and now anger, but then just a bucket load of unresolved anger that they've been maybe carrying for 30 or 40 years.
That's really helpful, that word overdetermined, because that helps us to start to differentiate. Because, for example, working with couples and they get into a fight about something that's not such a big deal, but there could be issues that are happening in real time that is important, and yet the extent of their reaction is being fueled by all this unresolved anger that then it's getting put onto this current situation.
Right. That's exactly what we mean by overdetermined. That's a practical example of overdetermined. And in the understanding of this theme of overdetermined comes the issue of agency. When we start to understand that a lot of our reactions are to one degree or another overdetermined, they can be real responses and at the same time being potentiated by unresolved material from our past and our history.
Okay, now I'm filling into another piece of this. You just brought up around agency, because the overdetermined, let's say, anger in some way feels much safer than the vulnerability of what could be happening. I'm just using this example of between the two partners, let's say, of a relationship. So the anger, the overdetermined anger, feels much safer from child consciousness than it would to actually deal with what's happening in the moment.
And to go with your example of relationships, because it's a good area, is that when we work with couples, for example, we see that so often, as soon as one or both start to allow more vulnerability, rather than the normal kinds of blaming, angry responses that they have towards their partner, the other partner, there's a greater likelihood then that the other partner will allow themselves to be more vulnerable. And then they can start to deal with what is really going on and not all of the other overdetermined material that's there, but in a context where your partner is more likely to show up. Because think about it, if somebody's blaming and angry at you, how willing are you going to want to be to open your heart and be vulnerable in that context, versus when your partner is saying, oh yeah, I'm sorry, I didn't realize that what I said was really hurtful. Usually, so often, at least with healthier couples, when one partner can go to that more vulnerable place, the other partners tends to follow. And then you can start developing this virtual cycle, rather than a vicious cycle. You get this virtuous cycle where one partner's vulnerability will open the space for the other's vulnerability. And that makes for the possibility of then real connection, a heart-to-heart connection between the two.
Okay, so rage can either be healthy in the face of extreme provocation, or it can be the buildup of a lot of unresolved anger and other emotions as well. Not sure if there's a question in there, but I'll let you respond to that.
Well, I think it brings up the question, the important distinction that we make in NARM between anger and rage as an emotion versus anger and rage as behaviors. Because I think particularly with rage, people tend to think about the behavior and the destructive behaviors. And there is no such thing as an unhealthy emotion. There are unhealthy behaviors, of course. Emotions are not destructive, but behaviors based on that emotion can be destructive. So it's an important distinction to make between the emotional experience and the behavioral response that comes with that.
Yeah, I just think that bears repeating, because at least in North America, our training is so heavily weighted to behaviors, and understanding what's driving those behaviors, and particularly the emotions that we focus on in NARM, is so useful.
Yeah, and just to be clear, when Brad was saying North America, he didn't mean the NARM North America, but in the field of psychology, and we can name names. We're really talking about CBT and the limitations of just looking at behaviors.
Yeah. Okay, so within many clients, there's a distortion of rage that creates impulses for vengeance, violence, an attempt to move the hurt from inside onto someone else outside. Mm-hmm. How does NARM work with the impulses towards vengeance and violence? That's a really good question.
Yeah, well, the official word for this is the talionic response, or the talionic impulse, this impulse for revenge. And impulses are fine. And in NARM, we're always supporting containment, so that to feel the impulses and to feel what it is that the impulses want to do, there's nothing wrong with that, as long as the person is clear that they have impulse control and won't act those impulses out. Because when this talionic response is acted out, it actually just creates destruction for everybody involved. But you see, rage is there. It's a communication. And as we get present to and feel the impulse with guidance, usually, we can see what is it that the rage is wanting to accomplish? What is it that the rage is wanting to resolve? And the fact that it's built up to this level of rage means that it's probably, this dynamic has been going on for a long time, or different iterations of this dynamic have been going on for a long time. So as the impulses get recognized, and as we understand what it is that they're really trying to accomplish, then the client or we have the possibility of integration from the powerful energies that are there in both rage and anger itself. And we see then, as these energies get integrated, they lead actually to increasing capacity for separation individuation. They lead to an experience of strength. They lead to the capacity to recognize and communicate your needs and feelings. So when it's integrated, when it's not acted out, it's a very powerful vehicle for change to integrate even these impulses towards vengeance.
A question I get a lot from people that work with clients that are acting out much more is like, how well does NARM work with clients that don't have good executive functioning or good impulse control?
Well, it depends on what setting a person is working in. So for solo practitioners, in other words, therapists who are in private practice, if you've got clients who are heavily invested in acting out, that sometimes can be very difficult for a solo practitioner. They either need some kind of ancillary or adjunctive kinds of group experience or 12-step program experience, depending on what it is that they're dealing with, to create structure. Because the danger or the challenge, at least for therapists, when you've got the clients who are into acting out impulses, is that as soon as they start to feel more of whatever it might be, any emotion that is threatening to them, there's a tendency to act out on other people.
And so when we have clients that are like this, and you're in private practice, let's say you don't have a lot of support around you, I mean, is NARM the right treatment for working with someone that has that lack of impulse control? and executive functioning?
Without adjunct kinds of help, I'd say probably not. If you've got somebody who's really into acting out, and again, if they're into that level of acting out, there's probably some kind of personality disorder, or even worse, depending on the dynamics. Now, we do teach in the master and postmaster class, I do teach people how to work with personality disorders so we can work with that. But still, if the impulses to act out are too strong, that would probably be an indication that the therapist is in over their heads, and they would maybe need to refer that person on to some kind of more structured setting.
Yeah, I keep on asking this point because I know a lot of therapists will take responsibility for it and think they're not doing a good job if their client is starting to act out, even though they were making progress. And I think the point that you're making here is important for a lot of us to hear, that as some clients start actually making progress is when they'll start acting out much more intensely.
So becomes a very challenging time. Now, we can work with that if the acting out isn't too severe, but if they're really starting to become a danger to themselves or others, one, we have a duty to report in most places. And just from an ethical and self-preservation perspective, it's time to be thinking about referring that person on, I would suggest.
Okay, so we're going to start talking about some of the clinical implications and how in NARM do we work backwards to support the integration of primary emotions? So from shutting down to splitting to anger to protest.
Well, as all the clinicians out there, I'm sure know, the clients who've experienced the most severe and difficult kinds of developmental trauma in their life tend to present initially with a tremendous amount of self-hatred and self-judgment and self-rejection. And that, you see, is a symptom of the splitting. That is the splitting dynamic as it is being acted in against the self. They're making themselves bad. They're shaming themselves. They're hating themselves. And remember, everyone, that a child cannot experience him or herself or themselves as a good person in a bad situation. And so that's part of what's driving this splitting, and the shame and the self-hatred and all of the kinds of outgrowths of the splitting process.
Okay. And so can we talk more about the clinical kind of process of how we're supporting our clients that comes in and they're actively self-hating and self-shaming?
Well, the first thing that we tend to do is we get descriptive. In other words, often actually, clients are so self-hating towards themselves and have no idea. They're so used to the kind of self-talk and self-judgment and all of the things that they don't even realize how cruel they are being to themselves. So just to name it is one of the ways that we begin this sometimes. Is like, I'm noticing that you direct so much anger against yourself, or as I listen to your words right now, I just hear this incredibly painful self-judgment that seems to be pretty much constant. And sometimes just describing and reflecting that to the client will begin to wake up that healthy part in them, the part of them that brought them to therapy, most likely, at least, hopefully. And it can start to create different dynamics and different possibilities for the person. And then, of course, who the therapist is and the level of compassion and non-judgmentalness that they bring to the therapeutic process serves as a model. And actually, you see that some clients that are filled with self-hatred first to have it named, and they'll expect that same kind of judgment and criticism and hatred from the therapist. And it will be surprising for them often when the therapist doesn't join them in seeing how terrible they are. And sometimes they'll try and convince you. I've seen therapists get into the trap of trying to convince the client that they're not as bad as that they think they are. And then the client gets into trying to convince the therapist, no, I really am as bad as I think I am. But my overall point is that the non-judgmentalness and the compassion that the therapist brings to the therapeutic process is a huge, huge support for the client. And they will begin to draw from that, along with increasing self-awareness. And then that becomes an internalized, the therapist becomes an internalized resource. The official languaging and object relations would be the introjected empathic object. And literally, I've had over the years many clients say to me, I made a mistake at work and I was just starting to get so angry with myself. And then I thought about you in our session last week. And, I thought of it and then I just kind of let it go. And we see that clients need that. Of course, we want to support them to develop that capacity for themselves, but they need it often from the outside at first, that kind of compassionate, non-judgmental, curious, and really loving presence that the therapist can bring.
I wonder if you can give an example of what does that look like when someone's able to resolve their emotional responses and able to be in a healthy connection with their own protest?
Well, once it's integrated, it could be as simple as saying, my meat was not, I had asked for it well done, and my meat came out medium rare. There are many people who've, even in a simple situation like in a restaurant, can't speak up, will not let themselves speak up and protest. It's just a simple protest on the surface of things. But for them, it feels impossible to just communicate their needs in that way. We could actually go through each one of the survival styles. And basically, when the protest is in place, the connection survival style will say, hey, I do have a right to exist. I have a right to take up space on this planet. The attunement survival style will say, hey, I have a right to communicate my needs. You don't have to meet all my needs. I'm not there demanding that they be met, but I have a right to have my needs and to appropriately communicate them. The trust survival style can say, hey, I have a right to be able to depend on people who say that they love me, and I want to be able to depend on them. And the autonomy survival style says, I have a right to say no. I have a right to set limits. This isn't right. This isn't okay for me. That's protest. And the love sexuality dynamic too is and we have to talk about it a little bit differently because it's a different dynamic, but I have the right to communicate my love and the hope and the right to hope that love will be returned to me. And so it's really the protest as it's there as just as a potentiality is part of what all of us as human beings need to have access to in a world that isn't always responsive to us, that isn't always mindful of who we are and what we need. And again, to do it in a way that doesn't diminish the other, but at the same time supports the self.
That was super helpful. Great. Okay. So why is it so important that clients stay with the anger until the feeling of protest emerges organically?
Well, I think that could be misunderstood maybe by some people watching, depending on how much of experience they've had with NARM. What I don't want people to get the idea is that we try and get people to stay in any particular emotion. As a matter of fact, if they're feeling angry and we know that there's still anger there, but then they disconnect from it, we won't try and get them to stay in the anger. We'll explore what's frightening about being in the anger, or what's the need to disconnect or to shut down or to depress yourself or to shame yourself. It isn't like we're ever trying to hold people in an emotion, but we do reflect when they start having various kinds of strategies to disconnect from the emotion. So we point out the fact that they're disconnecting without the intention of trying to hold them in the emotion itself. So that's the balance that we're always trying to hold with NARM. And I know that for some people, that's a little hard to understand at first, thinking that you can constantly remind people, like we might say, I'm wondering why all of a sudden you're judging yourself so harshly, whereas just a moment before you weren't. And then we see that becomes a way of, they started to feel anger, that was scary to them, and rather than feel it, they just started judging themselves. This dynamic happens in the therapeutic sessions all the time. And many therapists try and sidestep this or work around it or fix it. And in NARM, that is the process that we want to pay attention to, both when they're connected to themselves and their authentic emotions, and when they're disconnected. And we pay attention to both elements in a certain kind of a yin and yang process.
I think I know where this question came from. Let me know what this sounds like. But I think we were talking about how many other models, when they work with like anger, for example, they're about trying to like act it out or like scream at your parents. And I think maybe we were trying to reinforce this idea that in NARM, the staying with the anger is about not having to behaviorally do anything with it.
Okay, that makes sense. Now, some things clicked into place as you said that, Brad. So that it really, I think what we're getting at here is the emotional completion process.
Yeah, yeah.
And so that then is very different from acting out. I think everybody knows at this point that NARM is not cathartic, it's not abreactive, it's not regressive. We don't hit pillows or kick and bite and scream and all those kinds. That's not part of the work. But when there's anger there, we want to know what it is that the anger is trying to communicate to the environment. And that then, as they understand the communication and as they're present to the powerful energies of the anger and contain those energies, there's like an alchemical process in the sense that then this anger and rage then just becomes protest and strength and healthy self-expression.
Great. I think you've already talked about this, but maybe if there's anything else you want to add about the difference between feeling the intense emotion of rage versus bypassing or disconnecting.
Well, as I just mentioned, and reminding everyone that NARM is a psychobiological model. So, and I talk always about the functional unity between the psychological and the biological. And the emotion of rage is also an energetic, very powerful energetic state. And as we are present to these powerful energies and somatically, mindfully aware of these energies and contain them, that's what facilitates real shift and real change and real connection and dissolving old identifications. Whereas if we bypass or disconnect from it, we lose the opportunity to integrate these powerful energies that bring aliveness and joy and creativity and capacity for connection back into people's lives when that's been lacking.
Again, I think we've covered some of this, but anything more you wanted to add about how NARM differentiates between containment versus expression of anger?
When we're talking about containment, we're talking about being cognitively aware of the anger, but also present to the physical sensations that are there with the anger. And a lot of times you see, we'll be in a session and anger is coming up, and I'll ask the client, well, what are you experiencing right now? Because it's clear to me something's building in them. And they're clenching their jaw. That's a way of actually biting and holding back the anger. Their tendency will be to go, well, I feel pain in my jaw, because it's often clients' tendency to focus on what doesn't feel comfortable or what's painful, or that's a human tendency. And then I'll say to them, okay, so I know you've got this tension in your jaw. As you just are present to the anger, what do you experience in general or overall on a bodily level? And they're often surprised and they say, well, interesting, actually my body feels more alive, or I feel a charge inside. And I say, how does that charge feel to you? Well, actually, when I just feel the charge, it feels pretty good. And that is at least one of many examples of this physiological and psychological containment that we teach more specifically in the training. And that is really transformative. It's really a beautiful thing to watch as people's lives change, as anger and rage get resolved and integrated, and then it's just protest and capacity for self-expression and strength, and how people's lives can significantly change for the better as these dynamics get integrated.
I wonder if you could just talk briefly about the flip side, because there's still a lot of people that do use cathartic approaches. What's the limitations from a NARM perspective about using those kind of approaches?
Well, one of the advantages of containment, one of the big advantages of containment, is that when a person stays present to powerful emotions and contains them, there's a deepening that happens and a depth that happens in the person that opens doorways to all kinds of emotions, both pleasant and some unpleasant, but the capacity to feel increases, and with that, the capacity to feel more alive. Those models that still use catharsis don't provide the opportunity for this kind of deepening. When I was in private practice in Colorado, this is many years ago now, and primal scream was all the rage, and that book was bestseller, and it's like the primal scream people that I worked with anyway, the ones that I saw that came to see me after they fell apart using primal therapy, anytime they started to feel anything, they felt the need literally to go in some dark place, to lie on a mat and scream it out. And as a result, their capacity to feel got diminished rather than increased, because their capacity for containment, instead of a solid container, it was like a sieve. And then any emotion just kind of, you'd like pour a bucket into the sieve, but then it would all just dribble out because there was no capacity to stay present to, which is another word we'll use, to stay present to and contain these powerful energetic states that we call emotions.
Can you talk just a little bit more about how feeling and staying present to the primary emotion of anger and rage without acting it out can lead to this expansiveness, this identification, this sense of freedom?
Well, ultimately, a big part of freedom has to do with freeing ourselves from the past in a certain sense. Now, in NARM, we look at it slightly differently in the sense that the past is past, but what we carry forward into adulthood when we've had childhood trauma is our adaptations to what we experienced. So it's ultimately, from a NARM perspective, it isn't exactly freedom from the past, but it's increasing freedom from all of the adaptations that we've made to developmental trauma, which includes freedom from self-hatred, freedom from self-judgment, freedom to express ourselves in an honest and heartful way with people that we care about and love. And this is a big sense of freedom, that when we're acting out these old dynamics, we're literally stuck in an earlier time zone, so to speak. And when we feel that freedom, that brings with it, of course, the expansiveness that you see there too. It's experienced physiologically as expansiveness. In the Reichian model of emotions, pleasure is experienced as movement of energy from the core to the periphery. And most people know what that feels like, when you feel like, oh, you take a deep breath, and and there's like this openness to another person or to nature or whatever experience that you're in. And it's these feelings that human beings seek in a variety of ways, both healthy and unhealthy sometimes. But this desire, because this expansiveness is, from a NARM perspective anyway, is our deepest nature.
All right, well, that will lead us to our reflective exercise here. So we're going to invite you to take a few moments to reflect on a time when you allowed yourself to feel intense anger or rage and didn't act it in against yourself or act it out against someone else. So a time you were able to contain and stay present with the intense feelings of emotion, particularly anger and rage. Just noticing how this is internally for you as you reflect on this. Okay, well, we have a few minutes left, and there's a question that came in. Larry, I'll read it to you. There's kind of two parts to the question. The first part is, can you give us some ways to help people contain anger? Mm-hmm. That's the first part. And the second part is some ways when we notice we start wanting to fix, to help us stand back and just stay curious about the other person's experience.
Well, again, we're not trying to force anybody to be in any particular state, but we do reflect when they use various strategies to move away from it. And just reminding them there is this spontaneous tendency then to develop more capacity for containment, because you're pointing out basically the leaks in the container that are there. And they basically, instead of going and letting all of this energy kind of dribble out in one of these leaks, it's there, but there's other leaks. And we just begin to address them, and also the ways that the energy has been directed. I had another thought that I was thinking about: social change. It's obviously an important theme in our culture right now. And there can be a very real, like how you channel anger. And of course, a lot of people are channeling anger that comes from different places. But one healthy way to channel anger is through social change. But when we do that, not as a substitute for our own personal work, but as the result of doing our personal work, and that we have more energy available to us, and then we can actually use it in constructive ways. That's just one example of a constructive way that we might channel anger once we're more aware of it.
The other part of that question was about helping, like when someone starts to want to fix the other person's experience. Anything you can say about helping this therapist to stand back and stay curious about it?
If they're wanting to fix, then they're assuming that something is broken. And I wouldn't necessarily assume that. What we might be seeing a symptom. We want to see what's driving the symptom. And most of the time when people are talking about fixing something, they're really talking about fixing symptoms. And in NARM, the focus is more on what's driving the symptom than just fixing, quote unquote, the symptom itself.
Exactly. All right. Well, take care, everyone. Thanks again. Stay well and healthy.
Thanks so much, Brad. It's been great as always. Thanks, everybody.
Bye.
If you enjoyed this episode, we invite you to check out the NARM Inner Circle, where we host NARM topic webinars like this one every month. Here's a sample of some of the in-depth topics that we cover: differentiating shock and developmental trauma, working with shame, self-hatred, and self-sabotage, complex trauma and addictions, working with the body and developmental trauma, relational trauma, intimacy, and sexuality, addressing burnout and helping professionals, and the NARM approach for supporting personal and spiritual growth. I myself have personally enjoyed being part of the Inner Circle. I love the ability to connect with other NARM professionals on the Facebook group. I've created some really meaningful relationships there. And I also appreciate having 24/7 access to deepen my learning. I'm always hungry to learn more, and it's easily accessible via the NARM Inner Circle webinars. To learn more about the Inner Circle and sign up for a free 2-week trial, please visit www.narmtraining.com/free trial. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community and connection with you and changing the world by transforming trauma.